Hello everyone, my name is Miguel Villagra. I'm an internal medicine physician, hospitalist, telemedicine provider with license in 20 states, and I'm also the founder of Adoctorsjourney, and that is a coaching program and now a coaching platform with a niche of physicians that are interested in career transition, some of them interested in getting involved into the healthcare innovation space. I particularly am very excited to share that part of my journey, and I am currently in the process of pivoting my coaching program to deploy my services using positive intelligence into the healthcare innovation world for small companies, small startups. I first started as a digital health advisor for some companies, and now I'm also an investor of some of them. And all started as a digital health fellowship that I did a few years back. And I was exposed to a lot of different products and line of services that make me realize how through healthcare innovation we can improve the healthcare system of United States. And that was one of the reasons that helped me give me passion about the topic and somewhat even reignite my career and let me pivot my coaching business to get into this tap market. The first thing that I would suggest for anyone that want to get started is to know and understand better where you are in your journey. We all go through different phases and transitions. Knowing and understanding what your goals are will give you that level of clarity that will say this is the best course of action that I need in order for me to keep growing. There is a lot of growth, but at the same time, there is a lot of risk when you pivot into digital health space. And I am here to tell you both sides of the story. Now, the first thing that I want to say about anyone that want to get involved is to try to connect and be in the right platform for finding some of these companies. Like personally, I started doing it through the telemedicine route. I saw the explosion of telemedicine companies coincide with COVID. I started getting more license, I started getting more offers, and I leveraged my clinical expertise not only to provide services, but at that time I was already growing my coaching program and I started coaching the members of their team, and I saw that opportunity. Some of these companies didn't know much about it, and I just leveraged all the skill set that I had. That's the invitation I have for you to stop and reflect what is your career portfolio, what are your strengths. To be noted, some of these companies require a certain level of background or skill set, including some digital and technological background. Communication is crucial and a key. Team leading. Most of these skill set you already have, or you can easily get to learn by being exposed to the right people, the right team, the right coach, or the right courses. There's no excuse for not to narrow any potential knowledge gap that you have. In that regard, I will say though that most physicians are in a best position to be an advisor and eventually even possible an investor on some of these new companies. You know your craft, and there is good data that support that healthcare startups that embrace physicians in advisory roles in early stages have more chances of being successful in the future. And they know the need of it. That's the part where you can leverage your clinical expertise and try to connect with them and build that relationship. Going back to relationship, how you find those companies, a strong LinkedIn profile is going to be crucial, and that's one of the things we help teach in our coaching program, how you can be presented to this company, how you can highlight all your accomplishments, and therefore you feel more or you look more attractive to be part of them. On the flip side, you need to build those relationships, you need to connect with them, you need to know the team behind them. That is going to be one of the things that it's going to require some time as you build those relationships, but you can do shortcuts by getting again in the right settings with the right group of people that can get you that introduction. Like for me personally, I started with this fellowship. I started getting connected with other platforms. I started getting to know venture capital investors, healthcare entrepreneurs, CEOs of small companies. That led me to see the opportunity. By knowing myself, knowing the skill set, having the curiosity, I started to present myself and start to see more and more opportunities for me. That led me to decide to take the leap of start investing on some of these companies. And right now I'm an advisor for 4 companies, and I am also an investor of 3 other different companies. An advice and warning sign for those interested on this part is that these are high risk investments, and among 10 digital health companies, 7 will potentially fail. 2 will give you really good returns, and 1 can give you massive exponential returns. And that's the one that you want to eventually find. But diversification is going to be the key. The other tip I'm going to give you about the specific of angel investment is going to be that by getting on board with these companies in the early stages, you have more leverage to get more rewards and returns on your investment, and even the minimums, you can be less the amount of money you're putting on the table. But on the flip side, as this company grow, they already have a product or a service, and some of them already making money, etc. It becomes more challenging. You need to invest more money. It becomes a less risky investment, but there's always the trade-off of you need to invest more money at a given time. The other aspect of this journey of mine is the fact that you don't need to go all in. You don't need to stop doing what you're doing. You can just build all these relationships, and you go along and start getting involved. For me personally, I started with exchanging a couple of hours a month trying some of this product in exchange for equity of this company before they were going public. And I have seen those stocks growing in value as these companies grow in value as well. That has been very rewarding, and to me was at the time a very low risk environment. I have the time and led me to the next step. I start getting more involved in more formal positions. I start providing clinical services with them and start coaching them. That relationship led me to feel more comfortable to start doing the first investment. But going back to the community, having the right people behind you. Like for me, having this circle of advisor, I have people that I can call and share at the deck of this specific investment or this specific company who is behind it, and have the level of expertise of people that has been doing it for 5, 10, or even 20 years. That makes me feel more confident when I decide to go for this type of investment. For anyone that want to get to this space, you have 3 options. You're going to be involved as a digital healthcare advisor. You can get involved as an investor. And finally, the last step is when you want to create your own company. I believe that is possible, but it will require some time. Finally, I want to share with you that I'm launching an online course in partnership with the Innovator MD, and we're going to be tapping into an introductory course for anyone, any physician that want to get started into the digital health space as either investor or advisor or even a founder. And I believe it's going to be a very good resource for anyone to get just started. The second thing is that Adoctorsjourney is a program and a platform that connects physicians with some of these companies, but I specifically like to offer coaching to physicians to help them gain that clarity. If this is something that is reasonable for you to entertain, and what are the steps to get into the digital health space. I was extremely excited of being part of this event, and see you guys soon. Take care.